As someone who firmly believes that AI serves as a complement rather than a competitor to clinical expertise, how are clinicians adapting to this technology? Welcome back to Dental Talk. I'm Dr. Gary Glassman, and today we are exploring artificial intelligence's growing role in clinical dentistry. Last fall, we spoke with Florian Hillen, CEO of VideaHealth, exploring AI in dental diagnostics, and we asked the question, can AI make you a better dentist? We're going to turn to two Calgary dentists that use this technology. One of our partners, Dr. Scott Spackman, and an associate in the network, Dr. Tristan Ocampo. Gentlemen, welcome to Dental Talk.
Hey, thanks for having us.
Hi, thanks for having me.
I'm curious to hear your firsthand experiences. And as Dental Corp implements VideaHealth's AI platform across the network this year, is it creating more frictionless workflows? And more importantly, does it truly enhance the patient experience? Well, we're about to find out. So, couple questions, and please answer them whenever order. Scott, you can go first. Tristan, second. Talk among yourselves if you like. But really want to know is, tell us about your initial experience with Videa AI when it was first implemented in your practice. What were your first impressions?
So for us, a lot of excitement. Anything new in technology is always exciting. There's always a little bit of fear and anxiety as well, just because it's new and we don't know what we don't know. But yeah, the initial experience was excitement, wanted to see what this was, how it worked, how it would work with kind of our workflow. And I would say the staff overall just pretty excited to hear about it, to see how it worked and see how it would be implemented.
Tristan?
Yeah, I would say the same thing. I think that I had seen a lot of ads on my algorithm about AI overlays for x-rays, so I was really excited to get my hands on it. I like to educate patients and point out gray areas, so having that in color and just having it as a tool, I thought was going to be very beneficial. And then as far as my first impressions, I was also a little bit skeptical about whether or not it would be accurate, but after using it for a while, I was pretty impressed.
And were your staff as enthusiastic as you? Was there any resistance? Because I know when there's ever new technology, you know, a lot of team members are going, everything was great before, but now we got something else to use.
Yeah, I think we all have that experience coming back from a CE course and the team says, oh no, what's it going to add to our routine now? But fortunately, this integrated so well with Dentrix, and it's even faster than our current imaging software. So because of that, it really didn't add anything to the time burden. So people were very excited and happy to use it.
So clinically, what cases do you typically use Videa AI for? And has it helped you catch anything diagnostically that you may have missed with the human eye?
So in our experience, we use it for everything. So kind of the workflow that I personally have set up is I've asked the assistants and the hygienists to have the kind of the overall exam screen ready for me when I walk in. We've all got those hygienists and assistants even that are fantastic that will say, hey, doctor, look at this, look at that. What Videa I've found for me does is it's like that awesome hygienist. You walk in the room and instantly, boom, you've got highlighted all the areas of potential concern. It's not diagnosing for me, but it's just bringing to my attention. So pretty much every case I have it open and I'm using it. And then absolutely, I like to think I make no mistakes. I think we all do, but we're all human. And at the beginning, I was testing the software against myself. So I would look through things first and say, okay, does it catch anything? And eventually it did start to catch things that I would miss. There was a couple times it did. So my pride couldn't take that anymore. So I switched the order and had it. So I looked at the software first, and now I double check the software, which make my ego feel a little bit better.
Well, that's good. So it's like really a second opinion.
Yeah, absolutely. It's a second, third, fourth opinion is what I tell my patients. It's 1,500 extra opinions.
That's amazing. Tristan?
Yeah, so to piggyback on that, I also, at the beginning, had some trust issues with it. I would, toggle it on and off, the patient view, the clinical view, there's different sensitivities you can choose, balance, less, more, everything. And so I would be flicking through all of those and it would take more time. But as I've learned to trust everything, I think you can just go in and know that it's giving you something that's real and you can plan more effectively. And having been a more conservative dentist in the past, I would say it's actually probably got me to treatment plan a few more things that I wouldn't have before.
Well, that's a great segue into trust and trust with your patients as well. How do you explain, Tristan, how do you explain AI to your patients, and what's been their typical reaction when all of a sudden they see this really amazing technology right in front of their eyes?
Yeah, so I would say, AI has been a buzzword for quite some time now. So overwhelmingly, patients are very positive about it. They're very happy to hear we have AI. We have iTero, we have CAD/CAM, we have all kinds of technology. So it's very on brand for our practice. And then in terms of how I explain it, I just kind of say it's been trained on hundreds of thousands of x-rays by expert dentists who teach it what a cavity is and isn't. It essentially finds these gray areas for you, which we've always done, but it just does it faster and more accurately.
Scott, I'm sure the conversations with your patients have changed. How has this technology changed those conversations with your patients about the different treatment options, and has it affected treatment acceptance?
I would say it has. It like anything in dentistry, trust is key. And we're always trying to build trust with our patients. And so what it does is it just provides an extra opinion, an extra source of trust and outside look. When we have that hygienist that's saying, hey, look at this, and the patient's alerted to it, they go, okay, this might be a concern. And then if it's reinforced by what I'm saying, they now trust my diagnosis more. With the AI, it provides an extra person or, hundreds of people, thousands of people to say, hey, this has not just been looked at by me and my hygienist, but this computer software has also interpreted these x-rays and agrees with our findings.
How has, I'm sure it's changed the workflow, and time is everything, in our practice. Tristan, how has AI affected your workflow and time management at your practice?
Well, like I said, after you've learned to trust the AI, it really frees up a lot of time. I don't have to go back to the office and look at an x-ray for a few minutes and then go into the room. I think like Scott was saying, all the hygienists just bring it up. I go in, I see the findings, I confirm them, and it's just much faster. And I have that confidence that everything that needs to be picked up is, and so I'm not missing anything.
What about you, Scott? How's the workflow and time management being affected with the AI in your practice?
Yeah, I think the concern initially was that the time management would be a problem. This is another thing that we have to do. And at the beginning, because it is a new technology, it does take a few minutes to learn just, what buttons to press, where to go, how to set it up. But once you're set up, it has actually decreased, I would say, the amount of time looking at things, examining things, and also that, talking to patients, it builds that trust. And so there's less time. I mean, I don't think convincing is the right word, but there's almost less time educating. We can say what we want to say. We tell them what our diagnosis is. We say why we believe that's the diagnosis, and then I show them the AI. And that's just kind of the thing that seals the deal.
So when you first walk into a room, your hygienist or your assistant, and you can tell me which one or both, has AI up on the screen and they've implemented it. You come in, you walk in, you take a look at it as well. Of all your team members, the admin, the assistants, the hygienists, the doctors, which team members' roles have been most impacted by the implementation of AI? And have you created any practice consistency with your team that uses it?
So, I mean, I think it's affected everybody. It's improved everybody's game, made everybody better. At the end, though, it comes down to it as a diagnostic tool. And so I think it improves the doctor's abilities and skill sets the most. Because at the end of the day, we use it as a tool to interpret and make a diagnosis and make a recommendation for treatment. So I would say doctors, hygienists, assistants, admin, everyone's benefiting, but the doctors. The other thing I was going to say too that you had mentioned, something in our practice, because we are a bigger practice with 4 or 5 different dentists, is calibration. It's key. It's hard to all be on the same page. Sometimes one doctor might diagnose a little more, a little less, and trying to find, calibrating us all to be the same or very similar is so important for establishing and maintaining trust with patients, especially in bigger practices. What this program does is it brings us all to the same point. So if one person's a little more, one person's a little less, you can still make a diagnosis outside of the program, but it just helps bring us closer to the same thing. We end up diagnosing the same and we're able to learn from each other and the program actually.
Yeah, it's amazing. So it sort of brings everybody on the same level of playing field and standardize things is I think what you're sort of emphasizing. And I think it's amazing because it sort of puts a check on everyone. And I think it's a great way that it's impacted the whole team. Tristan, tell me some memorable moments. Tell me about a surprising or unexpected way that AI has improved a patient outcome in your practice, and has your treatment approach changed as a result?
Right. So I think there's a couple of scenarios. One for me, you might appreciate this as an endodontist, but upper PAs can be very difficult to read sometimes. I find that it's actually very good at picking up periapical variants. So, there's a patient that came in with sinus issues and we weren't quite as sure if it was endodontic or not, but the PA was pretty clear. And so that just got a diagnosis much quicker. And the other scenario I find that it's very helpful for would be, you have these new patients that come in, they've been going to their other dentist for years, and then suddenly their dentist retires. They say, everything's fine, I've always had checkup and cleans. And then they come to you and you find 10 interproximal cavities. And then that always puts a little bit of fear in me. How am I going to tell them this? How are they going to take it? But if it's something that they can just see visually, it's no longer me convincing them. It's more, this is what it is and how do we go about fixing it?
Scott, what about you? What about a surprising or unexpected way that AI has improved a patient outcome that you've had in your practice?
I think there's been many, but kind of one in particular that comes to mind is again, those periapical lesions in the anterior actually. So we have a number of senior patients in my practice. And so, we take periapical lesions of the anterior teeth and we review them, but what this program does is it does a fantastic job of finding lesions in the anterior. And it gives me the opportunity to then double check, is this a vital tooth? Patients never bugged them, but we see this lesion and sure enough, you look back and, it's there. And, we pulp vitality test it and the tooth is necrotic, it's dead. And so all of a sudden, and this has happened to me at least twice, maybe 3 times in the 3 months I've had the software, where I would have left that tooth untreated, that necrotic tissue untreated in the patient's face, just, eating away the patient. Whereas now those 3 people have gotten good endodontic therapy. They've benefited, that dead tissue is out of their face and those lesions can now heal.
That's great. Yeah. So AI really has, especially, I like the fact that you, Tristan and Scott, talked about that maxillary area, the maxillary teeth, because you have so many landmarks, so many, you have the sinus, you have so many bony areas and things that you can't see with the human eye, and AI really highlights that. And I think it's really, really important. And you caught some teeth that were necrotic that needed root canal treatment, which, warms the cockles of my heart as well. When you talk about root canals, get very excited as being an endodontist. So the future applications and the potential, I think, are limitless, really, as more data comes in and we gain more information and get more of those second, third, fourth, and fifth, and sixth opinions. Beyond diagnostics, what other aspects of dentistry do you see AI enhancing in the next, let's say, 5 to 10 years? Tristan.
Right. Well, I think, of course, treatment planning, I think there's going to be a day where we just input patient information and it spits out our risk factors, which is something we have to kind of come up with ourselves right now. I think we're seeing it in orthodontic, Invisalign Smile Architect and things like that. Just treatment outcomes, simulations, and I think we'll have a better idea of what will and won't work in the future.
Scott?
One, even just still in diagnostics that I would like to see is right now it does bite wings and TAs, but as far as I know, it doesn't do panoramic x-rays. CBCTs, just diagnosing that radiographic information would be fantastic, just to, again, elevate our game. Some ways that it could be implemented. I think we'll always need that human touch in reception, but after hours when people are away, using AI to answer phones, to, so that there is some sort of communication with the patient after hours. It doesn't replace the human, but it makes some sort of contact with the patient so you don't lose the patient. I'm excited for the future of that, hopefully. Like you said, I think it is limitless in terms of what can happen with it.
Yeah, after hours, you bring that point up, having an after-hour chat bot that will answer questions based on all the information from your practice and other practices that will help the patient after hours, during hours, however. I think what excites me also is within the aspects of dentistry and diagnostics is to see the progression of the disease that may be in a patient or patients. What it looked like 2 years ago and what it looks like now. And perhaps using the AI algorithms, what it may look like in 2 or 3 years if it goes untreated. So that's something that excites me as well. And as AI continues to advance, and I'll throw this question obviously at both of you so you can answer in order and in turn, but how do you see your role as a clinician evolving? Tristan?
Well, I think as we just have the AI analyze all the information, we're going to become more decision makers, I think everything is going to be pretty much laid out for us, and we just have to choose what fits the patient best and do the work.
Scott?
My experience with technology in dentistry, but in all aspects of life, is its purpose is to make us better and do things at a higher level. And so I think as AI evolves, as the technology evolves, it's our job to find ways to implement it, and to make ourselves better clinicians. I think the expectation, or the gold standard, as you will, of dentists will be raised from this technology. It's just sort of like, digital x-rays. You're welcome to still take film x-rays if you want, but you have to be able to diagnose and treat on the same level as everyone taking digital x-rays. Otherwise, you're not meeting that standard of care. So I think it is time before AI helping us interpret becomes the standard of care. And as clinicians, if we're not keeping up with those technological advancements, we fall behind and we stop meeting the standard.
I have a question that's tip of tongue, top of mind right now for me. What tip would you give a dentist that's looking to implement this technology into their practice?
So I would say first and foremost, positivity. Anytime you implement new technology, there's a little bit of resistance, and there is a little bit of just, learning curve. And it takes time to learn the buttons and learn where things are. So when the leader is optimistic, and positive, then it's contagious. People will follow suit. The other thing I would say is take the time to get to know it yourself as well, because again, as the doctor, as the dentist, you're going to be leading. And so when you ask the hygienist to have the program pulled up or open in a certain way, if you're not able to open it up and show people how to do it, then, it's going to fall by the wayside. So spend some time, learn how things work, try the buttons out, see where things are, play with the program. As you do that and get comfortable yourself, be positive, encourage team members, and then just really be excited about it. And that excitement will become contagious, and then you'll start to hear staff being excited too.
Yeah, that's great advice. Tristan?
Yeah, I totally agree with that. Just get the team on board, have everyone doing it, because you don't want to be the only one doing it and no one else in practice sees it. I like that for video AI, you can actually go back about 18 months or 2 years with the x-rays. So you can always practice on older x-rays to get yourself familiar with it, so that you know what you're doing the first time you show it to a patient.
Yeah, I totally agree. Well, Scott, Tristan, thank you for sharing your experiences with AI in clinical practice. Your insights really highlight the practical realities of integrating new technologies into patient care. And as dental technologies continue to advance, and they will, AI stands as a very, very powerful ally in our diagnostic toolkit. It augments our clinical judgment while it allows us to focus more intently on the human elements of care that truly define exceptional dentistry. It's always the human touch that make us stand out and that really, really allow that excellent patient experience. Join us next time on Dental Talk as we continue exploring innovations and strategies that help dental professionals deliver brilliant patient experiences in an ever-evolving landscape. Thank you very much, and until next time.